For years, you've been able to catch me chatting with callers and reading letters from listeners right here on my YouTube channel. Starting now, you'll be able to watch a full hour of my preaching, teaching, and nagging every Friday at 2 p.m. Pacific, 5 p.m. Eastern. The Dr. Laura Hour on YouTube is my new weekly show. Enjoy my commentary, conversations, and woohoo-worthy moments every Friday right here on youtube.com/Dr. Laura. Now, be sure to subscribe, set that notification bell, and share Dr. Laura on YouTube with a friend or anybody. 5 years after a divorce, a good 70% of people regretted it. So, when I nag you for giving up on your marriages because of the impact on the kids, I'm right.
Dr. Laura is on right now.
1-800-375-2872. This is a talk show. We don't have a topic of the day 99.9% of the time. So that means this program is dedicated to you, whatever you're needing at any particular moment with respect to your emotions, your relationships, your situations, choices you need to make, and what have you. When you call in, ostensibly, I help you out. Minimally, I'm preaching, teaching, and nagging at you. And hopefully some of that is helpful to you, but for sure, it's going to be helpful to people who listen. So you do a good deed for many, 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 many others when you call in to deal with something personal. So, unless you want 3 hours of humming, which I don't do well for more than 10 seconds, give us a call. 1-800-375-2872. Meanwhile, you're not going to believe this. Can you see that? Good. Massive study of 5 million children. So we can't say it was 50, it was 25, it was 100, hand-selected. This is 5 million children. Shows the brutal effects that divorce has on them. How negative are these impacts? 2 academics and a Census Bureau worker published a paper with the National Bureau of Economic Research, one that easily and brutally dispels the myth that children are generally okay after divorce. This was fascinating. Written by Andrew Johnston, Maggie Jones, Nolan Pope, Divorce, Family Arrangements, and Children's Adult Outcomes. So I'm going to read to you the high points of their research. Remember, this is 5 million kids. So it's not a small sample that could be tilted anyway based on your personal expectations. That's why you really need to have a very big N. We call that N, meaning the number of objects or people or what have you. So, nearly a third of American children experience parental divorce before adulthood. To understand its consequences, the article, we used linked tax and census records for 5 million people to examine how divorce affects family arrangements and children's long-term outcomes. Following divorce, parents move apart. Household income falls. Parents work longer hours. Families move more frequently. Households relocate to sometimes poorer neighborhoods with less economic opportunity. Parents often start new families. This bundle of changes in family circumstance suggests multiple channels through which divorce may affect children's development. Here comes the not-so-fun part. In the years following divorce, we observe sharp increases in teen making babies and child mortality. soul kind of wonders about suicide. We find that parental divorce reduces children's adult earnings and college residence while increasing incarceration, their mortality, and teen births, changes in household income, neighborhood quality, parental proximity, and oftentimes both parents don't stay involved because they're off making new families. All of these factors account for 25 to 60% of the impacts of divorce. There's no cherry picking or selective data usage because this is 5 million people. Of course, we've known divorce is bad forever. All the reliable data we've had for decades of easy divorce has shown us that splitting up families is overwhelmingly ruinous for children by just about every meaningful metric. To give you a quick list again, divorce increases teen births by 73%. That means your kids have kids as minors. Increases that rate 73%. Mortality, just a second. Okay. It also significantly drives up rates of incarceration by about 43%. And it drives up mortality by 35 to 55% at divorce, with these higher levels persisting for at least 10 years. There's just chaos in their lives. Now, the overwhelming majority of divorces happen simply because parents don't want to work out their problems and would rather just end it. Of course, as I've mentioned many times on this program, I think divorce is justified when, for example, there is violence, addictions. These situations are just not healthy for kids. However, I've known for decades, since I started working on getting my degree and license, the overwhelming majority of divorces happen simply because parents don't want to work out their problems and would rather just end it. That's the truth. And I remember reading a sociology paper 40 years ago where it pointed out that 5 years after a divorce, a good 70% of people regretted it. So, when I nag you for giving up on your marriages because of the impact on the kids, I'm right. My number, 1-800-375-2872. Jennifer, welcome to the program.
Hi, Dr. Laura. Thanks for taking my call.
My pleasure.
The reason I'm calling today is I'm looking for some additional help on how to get through declining. Like my body's just kind of going through a lot right now. About let's say over 3 years ago, I started a surgery on my shoulder, and it was just because of a weird cyst on my nerve, and it ended up having to be replaced completely with a shoulder replacement. And then subsequently after that, an infection, and then a different type of implant that had to come out because of an infection, and in total 7 surgeries. We had been putting off back surgery. I had 95% blockage at level 3 and 4, and after my shoulder had finally healed at some point in between all those replacements, I had the back fixed, and that was successful. And then, of course, the knees kind of went. I'm 51 years old, always been an athlete, and I'm now on my 7th knee surgery and can't seem to get to the replacement step because of infection after infection. And I'm having a hard time getting through constant bad news because my former life, I've been an athlete my whole life, and fitness trainer, Pilates instructor, my movement was my coping mechanism, which I'm losing. That's why I'm calling.
Let me understand. You said getting through. So there is a potential light at the end of the tunnel. Your shoulder's okay now. Your back is good.
Not really.
No.
No, the shoulder, I'm right hand dominant, and I don't have a glenoid, nor a cuff, like a rotator cuff, so I don't have full mobility anymore of my right arm, meaning from anything shoulder below is okay, above the shoulder is not.
Well, if you don't mind
So-
explaining to me, you had a cyst. How did this turn into several shoulder replacements? How did that happen?
Infection.
Infections. Are you? It seems like you're prone to infections.
Correct.
Does anybody know
So-
why?
Went to a rheumatologist and found out that I have an underlying autoimmune. They're under the lupus umbrella. Correct. Unfortunately, it comes up as undifferentiated connective tissue disorder and Behçet's. So it's more like treating the symptoms as opposed to a straight cure. There really is no cure. It's just toning down the symptoms. So I'm just chronically inflamed. But part of dealing with that in the past was knowing that the movement would somewhat help with that. So instead of running, I chose swimming. Well, then after my shoulder and back went, I couldn't do the swimming. And then after no longer running or long distance walking because of my knee went, then I focused in on my Pilates skills, and that was fine. But now I'm so jacked up, for less of a better term. There's really not a whole lot I can do from being, like for instance, in the last 3 months, I had 2 quad tendon repairs. My body rejected both of them. My kneecaps were literally on the side of my one leg. And so walking is really throwing off my kinetic chain. And before all of this, I was due for my second back surgery because the fusion forces the levels below and above that vertebrae that have been fused to take a lot of stress. So my SI joint is severely unstable. But we had to push that off because they won't fix your back, of course, until you're walking somewhat straight, so they don't you don't mess up the back surgery, because after a fusion and something like that, you need to have a proper gait. You can't be bending. So it's just one thing after the other. It just doesn't seem to end.
Well, with the diagnosis of the underlying inflammation, chronic inflammation, sounds like you're looking at this as not having an end.
Correct.
In terms of the underlying problem, where have you gone where there are experts in autoimmune?
Been to U of M and to 3 different well-known rheumatologists in the area that have done extensive testing and send that off to different laboratories. It's not just in their current office. They're sending it to...
and nobody comes up with an understanding you're that quirky?
Yes, in fact, and when I go to many doctors' offices, they can't believe how far I've come for what I have and want to do like case studies on what I'm able to do because of my condition. And it's basically because I was such an advanced athlete and, one of those workout gurus.
You started out so strong, yes. That certainly has helped.
Correct.
Imagine if, I
Correct.
can't imagine. I don't want to. Boof. So you're calling me in how to feel better?
Yeah, I mean, I'm trying to push through it and try not to put too much pressure on. I have 2 really amazing, friendly, nice daughters, or ugly people, as you would like to say. They're, just wonderful people. And ironically enough, both very successful nurses. But, they have their own life.
Right. So what do you do to emotionally get through the day? What do you do now?
Sometimes, depending on how I feel, I can lay on like my reformer and get motion through using the straps. But I've gone back into my second master's program, which is actually clinical mental health. And that's helping. It gives me a sense of purpose, which I know I thrive on. Who doesn't want a sense of purpose to get themselves out of bed?
That's right.
Other than that, You lose your network of friends, because I really can't go out and do anything. I used to call friends to go biking, but it's just I see myself and my world is really changing, and I just
You ever
don't-
wonder how you just got so unlucky here?
you and everybody else and myself, yes,
Yeah.
very much so.
This is
I mean,
really
I hate
rotten
even
luck.
telling people about it. When I see somebody I haven't seen in a while, it's like, oh, how's the shoulder? Oh, no, wait, the back. Or is it the knee? And so, they don't even know what to say at this point.
Right. True. Good point.
When Dan called me, I was literally just finishing up my first dose of antibiotic because I was supposed to have knee surgery. Got the surgeon's call yesterday that, lo and behold, there's an infection in that knee, so that's pushed off another 3 months. And then, of course, the sequence of the back surgery is delayed severely as well. So you sit in pain. Everything hurts. And you don't want to talk about it, everybody, because it's so old news.
Your studies. What is the point of your studies? What do you hope to do with that degree?
I'm only 51. I've got a sharp brain. I can't rely on being a fitness or Pilates instructor for the rest of my life. I mean, even if I could just verbally instruct, that's great, but it's not going to be enough.
Right.
I'm way too motivated, so I'm going to get into therapies. And I'm hoping, because of my experience, perhaps working with people that have dealt with a lot of trauma and physical restrictions, change of life. Obviously, I think I can really relate. So that's probably
going
a year and a half away.
I'm happy to hear this because I think this is a very intelligent idea. I'm going to give you a piece of advice for you as a future therapist, but it's also going to impact you today in this call. And I called it advice. It was something told to me when I started working as a psychotherapist. I was frustrated about how I couldn't get this particular couple to get better. Couldn't get them to get better. And the last time I saw this couple, the husband, and these people were like 40 years older than me, came over and patted me on the head and said, "We're happy with this level of okay." Of course, I couldn't understand that. No, this has to be 100% fixed and beautiful and like in a textbook. No, we're happy with this level. We're okay. So I went to my supervisor and I said, I'm confused with this. And he said a couple of things, and I want to give them to you for you to use today and every day past this, and for you to use when you're in counseling with people who are suffering in ways you understand. Not everything can be fixed. And to quote a movie, this may be as good as it gets.
Very understandable. Twice.
And you have to be, in your own mind, in a place where you can tell other people that. And coming from you, it's frankly more important than coming from me.
Understood. Yes, thank you for that. I can already visualize myself sitting across from somebody that is as frustrated as I am and telling them that it's okay to be where you're at. It's hard for me to even say, but I guess I'll be honored to give that gift to somebody.
Yes.
And change their life and stop making them stress out and wish for the better, looking backwards.
Yes.
That's not healthy. Thank you.
You're going to be a wonderful therapist, by the way. I can feel it.
Well, you've been an inspiration since I was about 10, so that's going on 40 years. God bless you.
God bless you.
Okay.
Okay. Call me anytime.
Keep doing such great work.
I can be your
Will do.
supervisor
Bye for now.
when you're therapizing.
I'll be reaching out.
I'm here.
Thanks again.
You're very welcome,
Okay.
sweetheart.
Bye-bye.
Take care.
Bye. Bye.
I'm Dr. Laura Schlessinger. I'm going to take a break and come back with your calls at 1-800-375-2872. Download the Dr. Laura Call of the Day and Dr. Laura's Deep Dive podcasts on my website, drlaura.com, the SiriusXM app, or wherever you listen to podcasts. Are you traveling this summer? Will you leave instructions for a house sitter? The name and number of your vet? The code to your alarm system? Think about the steps you take to prepare for a vacation, and you'll get a sense of what goes into a knockbox. Knockbox is a complete system that helps you organize all of your accounts, possessions, and estate plans for your next of kin. Each knockbox comes with a comprehensive checklist that helps ensure you add everything they'll need to manage your estate when you're gone. From your funeral directives to your insurance policies and even the keys to your storage unit, the knockbox helps you organize it all. If you've got a household, you need a knockbox. Right now, Dr. Laura listeners save 16% off the knockbox of your choice. So go to the knockbox.com/Dr. Laura. That's the NOK, knockbox.com/Dr. Laura to get organized and save. Or visit our sponsor page at drlaura.com and click the Knockbox logo. Carol, welcome to the program.
Hi.
Hi.
How are you?
Good. How can I help?
Well, I am recently widowed in the last year and a half, and after being married for about 35 years to my best friend, and I'm trying to figure out how to move ahead. I'm
sorry.
like I'm
what does
stuck in
move ahead
glue.
mean? You have to define it, describe
Move ahead
it.
means move forward with my life.
I don't
to
know
have
what that means.
meaningful relations.
Sorry, these are
I'm trying
just phrases. What does it mean to you to move forward? What would you be doing or differently if you moved forward?
If I move forward, I would be connected to other people, maybe having a relationship with another man in the future.
Is that the primary
things
focus of
that-
moving forward, to have another guy?
It's part of it. I think I have to say that's something that I would really like to have in my life. Yes.
Okay, so
like
let's
I said,
list.
I'm only 75 years young.
That's old, okay? I'm 78. This is old. We're old, okay? And you have to put that in a context of a lifespan, okay? So moving forward, number one, new guy. Okay, what else is under moving forward? I'm making a list.
Living in a community where there's more people, where I have more connection.
I'm sorry, that means you'd have to move from where you are to where? Give me an example of where you'd move.
Well, like I live at the beach in a community that is pretty much not anything other than renters that come to the beach.
Where
So
would you
I guess
move
moving to-
that would be a community? Tell me where. You mean one of the villages where everybody has to be 60 or older to move in?
Probably that would be a good place to go. Yeah.
Okay.
I think that would make sense.
Okay, number three. Moving forward, number three. Number one is a new guy. Number two is moving into a mature individual's community. And what's number three?
Finding happiness.
Oh, come on. We're happy in moments. We're not happy perpetually. That just doesn't happen. You've never been happy perpetually. Nobody has. So let's drop that silliness.
Well, finding more moments of happiness. How's that?
No, those happen. They happen. You want to give me something over which you actually have control?
Like what?
I don't know. I'm asking you. Moving forward to you is unique to you. Moving forward to me was different for me. I'm trying to understand you.
Trying to connect to a community, to
Oh,
move
we got that
someplace
was
where
number
there are
2. That was number 2.
Yeah.
Is there a
But
number 3?
trying to be connected with humans.
Is that so? That's number 2. So now you know you have to look for one of those communities for mature adults. And there you might meet some nice men to form a relationship with.
But mostly a lot of women.
Well, these are often families that live there, husbands and wives and stuff like that. Well, if you just want to get a guy, go on the net today and sign up for a dating app for people over 70, okay? And start dating, and maybe you'll find someone. But whatever it is, you've got to get off your butt and do it. It doesn't happen. We make it happen. I decide small things make me happy. I have a new idea for a project. So I went someplace, got these little tools, figured it out, decided what I was going to do, and that moment I felt happy. But happy is something we create by our effort and our perspective. You're not going to be happy because you're breathing. The world does not care about making you happy. The world is here for you to use to have happy moments. So if you'd like to move into a community where there are lots of people, go on the net and find a local place. Go check a few out. If you want to start dating, go on the dating apps and do that. But sitting around or going into therapy a lot and talking about how you wish you were happy and how you wish you could move on is just a waste of money, and it's nonsense.
Okay, I guess I'm wondering, how do you go on to an app and know that it's a safe thing to do?
You don't.
I guess that kind of
You
concerns
don't. That's why you talk to people. You can do a background check.
Okay, I hadn't thought about that.
Yeah.
All right. Okay. What else? What else would you suggest?
I don't suggest anything for you. You suggested 2 things: dating and living in a community with like people. Those are your things. Don't go to therapy and discuss this. Do it. My number, 1-800-375-2872. Folks, this happiness thing. I just want to feel happy most of the time. Well, that's why people go on drugs. They relate that as happy. I find happy moments in the weirdest of things. Something cute, a friend texts me something, and I go, well, that's sweet that they thought of me, and that makes me happy. So at any one moment, I can look for things to make me happy. My tea is at the right temperature. There is a right temperature, by the way. And this mug, one of our Dr. Laura SXM mugs, wait a minute, take a sip, prove it to you. It keeps the tea at almost a constant temperature for the whole time I'm on the air. That makes me happy. So if you're looking for some guy who's going to date me and that'll make me happy, well, that's temporary, because then the relationship gets real. Fantasies are put aside for reality. But, you've got to go get it. You've got to look at small things and go, makes me happy that my tea is just at the right temperature, so I don't have to sit here and go, it's too hot, I can't drink it, it's too cold, it's okay? All right. So, my number, 1-800-375-2872. I now have 2 lines open. Come on, jump in and take them. I bet I can help you if your mind is open. Okay, Renee, welcome to the program.
Hello, Dr. Laura.
Hi.
Thanks for taking my call.
My pleasure.
Hi.
How can I help?
I am currently separated from my husband of 31 years as of last week.
When you say separated, is this a legal separation?
No, it is not legal. There's no discussion about divorce right now.
Well, then
but
what does separated actually mean in your case?
He lives with another woman. He left me. Well, I asked him to leave because he would not end an affair. And
so you're sitting around wondering if you're still married? Are you kidding me?
Well, I know we're not. No, I know it's all paperwork at this point. I'm not in a marriage anymore. But at the same time, I still find myself wanting to save the marriage.
That's nice.
He's still
That's
involved
nice.
in my life.
That's nice, but unrealistic.
Mhm. Okay.
I suggest you get an attorney and protect yourself financially, etc. And if you have children, you have to consider those issues. So if you have minor kids, that is. I think it's very foolish of you, and you're in a deep state of denial, grief, and you're being foolish. You have to take care of yourself now. He's taking care of himself.
Can you explain how a man who is got this strong character and is the pillar of the family suddenly chooses a different life without any warning?
I don't know how people go into malls and shoot people. I can't explain that either. You don't have to understand it. You have to deal with it.
Yeah, I just don't understand why he...
Ma'am, I just said you don't have to understand it. And women in particular do that. Okay. I can't do anything about this situation until I completely understand it. No, that's a way to avoid dealing with it. You don't have to understand it. You have to accept it and take care of yourself. If you don't wish to take care of yourself and you wish to just stay in limbo on the off chance that he comes back and forth a bit, that'll be your life.
Right. It has been. Yeah.
Well,
and the calling, and I think it's abusive. Calling on our anniversary to wish me happy anniversary.
Yeah, that's pretty sick.
It's insane, and I know this because
no, it's not insane.
It is sick. I know
sick.
that
You're right. It's abusive. It's digging it in.
It's abusive. Yeah.
And you do know you're going to die one day, right? You do know that. I seem to have to remind people you are going to die. So sometime between now and dead is X number of days. And look how you're misusing yours.
Right.
You're not going to get them back. So it's up to you.
No, I know this, but listening to your last, not the last person that called, but your take on divorce and how it affects children. I am a child of divorce, so this is very, very difficult and something I never wanted for my children. And so when I'm faced with it, I'm just frozen.
Call an attorney and let the attorney start handling business.
Yeah.
You're going to feel crappy for quite a long time. That doesn't mean you shouldn't take care of business. You can do both of those at the same time.
Right.
Take care of business, protect yourself, and whatever minor kids you have, and start having more respect for yourself.
Yeah, I have adult children.
Well, then we don't have to worry about them.
Yeah, that's what it is. Okay, thank you.
Please get an attorney to help you.
Okay.
You gain nothing and you potentially lose a lot by letting him have all the power right now. And somebody else is helping him spend your money. Don't be a doofus here.
Well, he does pay for everything still. And I still got my mortgage paid. I still have my checking account. I still have
that won't last forever, dear.
I do have...
That won't last forever. As soon as she turns up pregnant, for example, that will end immediately.
Oh.
His guilt will...
She's in her 50s. We're all old.
His guilt will fade, and you will be screwed. So listen to me. Call an attorney today.
Okay.
please. My number, 1-800-375-2872. Going to take a break. Have a line open now. Give me a call. Be right back. Download the Dr. Laura Call of the Day and Dr. Laura's Deep Dive podcasts on my website, drlaura.com, the SiriusXM app, or wherever you listen to podcasts. Seeing fine lines and wrinkles creeping across your face? Oh, that's no day at the beach. Let Vibrant Super C Serum bring back your healthy glow. Brighter, firmer, smoother. I'm so happy I discovered Super C Serum. It outshines other more expensive products I've tried. Vibrant Super C Serum is made with the highest quality vitamin C, hyaluronic acid, and vitamins B5 and E. Bursting with a citrusy scent, it hydrates, smooths, tones, and even helps fade the look of dark spots. So simplify your skincare routine. Let Super C Serum replace your day cream, eye cream, night cream, neck cream, wrinkle creams. If you don't find it better than your current regimen, they'll give you a refund within a full year of your purchase. So go to Vibrance.com/Dr. Laura to save up to 37% off and get free shipping. That's Vibrance, Vibrance, Vibrance.com/Dr. Laura. Jason, welcome to the program.
Thank you. Thank you for taking my call.
You're welcome. How can I be of service?
I'm calling because I have been experiencing some problems with my sister for the past few months in that she has always had a very poor way of communicating with me by yelling, by having meltdowns, etc. And I'm trying to avoid labeling her or whatnot. So I've had to try to protect myself by really setting limits and
labeling
boundaries.
her as what? Boundaries. Don't talk about being cattle. Labeling her what? A pain in the ass?
I don't want to say no. I don't want to say narcissistic because
no,
I'm not
but you can say pain in the ass.
because
Narcissistic doesn't help
Well,
you. Understand?
rude.
Calling a label of a diagnostic type does not help you. Knowing that somebody is a pain in the ass, rude, and difficult to get along with is enough. We don't have to give it a label. We can just decide how much we want to spend time in that environment.
Okay.
Because we have no way to stop somebody from being a pain in the ass. Nope.
Well, I just think it's very difficult for me because she is a pain in the ass, or she's rude, or she screams at me, or she's condescending.
Then minimize contact. Don't be silly. Keep sticking your hand in the water when there are crocodiles. And then complaining that the crocodiles bite.
Well, I haven't had any contact with her recently, and
Good.
I have
what's your question?
Been able to. Well, my question is that I'm just wondering if I should. I don't know. I'm not quite comfortable with that. That's the way it just has to be. And I don't know if I should try to
stick your feet in the water and see if you're bitten.
Oh, I think I'm going to get bitten, so I think that's my answer.
I'm sorry, we can't have everything we want. Not everything can be fixed.
Correct.
And just because somebody shares some DNA doesn't mean you guys are compatible or sweet to each other or a match or anything.
I'm disappointed because I thought that we had a commitment to one another as family members to be close and to be kind to one another. And
well, that's your point of view. You can only work with somebody who shares that, who puts that ahead of their own emotional immediate state or needs. But if she's not that way, then you can't have that. Yes, that ought to be nice on a perfect earth, but it's not necessarily even typical.
It's true. Okay. Well, I will bear all this in mind. And I appreciate your
That's
calling.
why God gave us friends.
True.
Because then we can pick them.
True.
And then we can be true, loyal, sweet, and kind to each other as friends. Doesn't have to be DNA shared. So turn to your friends. My number, 1-800-375-2872. Brad, welcome to the program.
Thank you, Dr. Laura, for taking my call. I've been a listener since the AM radio days.
Thank you.
It's good to it's an honor to speak with you. Thank you.
Thank you.
I've listened to your show and I hear the references to your proper care and feeding of husbands. And I have to say, I'm hearing these things and I'm thinking, man, I wish my wife would read this book. We have an anniversary coming up. I can't imagine how it would go over if a husband says, here's what I got you for a present, how you could be a better wife. I don't think that goes over real well.
Yeah, I'm with you.
And so I'm
timing
trying to come up with
sucks,
ideas on how to. Yeah, that's right. If she had a girlfriend give her one, that's one thing, but it's hard to come from me. And so my question was, well, how to get her to read the book and embrace it the way I would hope she would.
Okay, well, I can't guarantee her embracing it, but
no,
I suggest you get the proper care and feeding of marriage so that you have both of them.
Okay.
And then say to her, I was listening to a radio show and everybody was saying these two books are great, and wait 2 months before you do this. I don't want it anywhere near your anniversary. So I would like us to read and, share what we think about this, because a lot of people were saying this made their marriages better, they were happier, they lasted longer, and so I thought this would be great. That way you have both of them, and okay?
I love that. I did not know there was the marriage book, because I was thinking there ought to be a husband book out there somewhere. So
yeah, it would be one page. Yes, dear.
Yes, I always get the last word, and that's it.
Okay.
I appreciate you. Thank you so much.
Thank you. Take care. My number, 1-800-375-2872. I'm Dr. Laura Schlessinger. Now go do the right thing. Download the Dr. Laura Call of the Day and Dr. Laura's Deep Dive podcasts on my website, drlaura.com, the SiriusXM app, or wherever you listen to podcasts.
Hi there, I'm Stacy, Dr. Laura's content guide.
Have you ever had a problem and wondered, what would Dr. Laura say?
Well, I've been having some marriage problems lately.
I'm no longer speaking to my family because they were mean to my wife.
My husband says he doesn't feel a spark between us anymore, but I just don't know what to do.
Struggling as a stay-at-home mom, dealing with a divorce, managing mother-in-law issues. Just tell Stacy and she'll recommend calls of the day, deep dive podcasts, and even YouTube videos.
I'm seeing a strong theme in Dr. Laura's resources about dealing with family members who are disrespectful or unwelcoming towards a spouse. Which of those topics stand out to you?
Really, I can't wait to hear how Stacy helps you. It's a brave new world. Join me on this journey, and let's make a difference together.